if you talk about future hospital in Pakistan, we can segregate that topic into multiple points. That first of all, how can we run the outpatient of a future hospital? How can we do the home care in a future hospital? How can we do the operative surgery in a future hospital? So if we talk about outpatient, then I think artificial intelligence has a lot of role to play, because we can do the medical record searching and the doctor can prepare him or herself much better before seeing the patient. So being informed about a patient through medical records, through AI, gives the doctor a head start. If you talk about diagnostic assistance, then the AI can actually help you have a wider differential diagnosis, given the history, given the medical record searching. So the doctor can be much facilitated and assisted by AI. And if you talk about AI in the pre-consultation summary, the chatbot can take a history of the patient before the actual clinic. So the doctor is presented with a list with a small history, and that saves a lot of time, and also it gives doctor more information about the patient. So yes, artificial intelligence, future hospital is a big merger going on. And if you talk about virtual home care, that means that a patient can be hospitalized at home with all the excellent coverage. Like there is a monitor which can record the blood pressure, the changes in the oximeter, the changes in the pulse, and the nurse can be sent, the medicines can be changed without being that patient in the hospital. So virtual home care, tele-home care, and also the artificial intelligence-led OPD assistance, that is my future hospital concept. I think gaining the trust of the patient, that what information or what treatment you're getting is from the authentic source. Because in Pakistan, sadly speaking, the advertisement of medical profession is on the signboards, on the roads, and patients don't know what is authentic and what is not. So there should be a regulation system which can prohibit advertisement of medical services by unregulated people. That's one thing. The second thing is that how can we provide free medications to needy patients? So we have to filter out who is needy and who can afford. And that system should be available to the doctor, who can actually see that beforehand in the outpatient. And then I think the patient can be guided through. Data privacy is also another sector, but I think in Pakistan, right now our priorities are to get the doctor to the patient rather than holding the data at bay. For international investors to come and invest in Pakistan, 230 million people, they are your clientele. That is 5th largest country in the world. So if 10% of that clientele is addressed, any investor has a prospect. So I would encourage the overseas investors to think about healthcare. Healthcare is not an optional thing, it's a mandatory cover. So healthcare investors, they will not be having a tough time in Pakistan as long as they hit the right target and the right need. And they work with the right people. You know, I participated in Health Asia's first event, and I was working in Saudi Arabia as a consultant. I was asked to come down and give a one-day workshop on digital informatics. So I remember Health Asia's journey. Dr. Zaki has been phenomenal. We have been working together since that first program. And I'm glad to see that the program has become bigger and more influential. So I wish the program well. I wish Dr. Zaki, Dr. Huria and the team amazing success in future. And I would like to contribute to that wherever possible.